As soon as the baby is born, first baby goes on mama's chest. Umbilical cord is still connected. At that point, everyone will breathe a sigh of relief. Celebration happens. That's typically how it goes. They're going to start stimulating the baby. We want to hear the baby crying, all that different stuff. The cord is still connected. They're going to ask you if you want to cut the cords. They're going to be some big scissors and you're going to go through and cut that rubbery cord. It's tough to cut, by the way. So don't ever be discouraged if you don't get it on your first slice. It's like a legit thick piece of rubber that you're cutting through. Once that has happened, then ideally the nurses are going to, at this point, take the baby from mom because mom still has to deliver the placenta. The placenta is basically a sac within your wife's uterus where the baby is, right? That is giving nutrients to the baby. So think about it as the middle place between your wife's body and your baby. And from that is where the baby's getting its nutrients. Once they deliver the placenta and that comes out, then the wife goes into recovery. They make sure she's stable. A whole another staff of people, typically it'll be a neonatologist, which is a physician who deals with newborns. And his staff will be in the room at this point assessing the baby. They're going to bring a plunger. They're going to suck the mouth out. They're going to suck the nose out. They're going to stimulate the baby, dry it off, clean it, and then start running quick tests on it. They're going to stimulate the baby's feet, check the hands, make sure that they're moving their hands and feet properly, listening to them with the stethoscope and things like that. Because when you're in the womb, the way your heart beats and circulates blood, and then also the way your lungs function are entirely different from the moment you come into the world. So they have to make sure that those transitions happen naturally so that the baby can start functioning and breathing on its own. Once that has been performed, then ideally they'll bring the baby back to mama and mommy can hold and do pictures and all that good stuff.